Welcome, dear students. I'm Dr. Yogita Goel, Associate Professor from SVKM's Institute of Pharmacy, Dhule, affiliated to Dibatu University. Today, I'm going to present Gastro-Retentive Drug Delivery System. Friends, before starting with the presentation, this is the disclaimer for my presentation. The contents of these presentations are: what are GRDDS system, what are the potential candidates, its advantages and disadvantages. We will see in detail the approaches for GRDDS and in brief what are the applications and references. What do you mean by gastro-retentive drug delivery system? As the name suggests, gastro, GIT, specifically here it means stomach. Retentive, from where this word came, retention, means to stay. Drug delivery means you are targeting at a particular site, you are sending the drug. So gastro-retentive drug delivery system means it's a system, a dosage form which is targeting the stomach, and it wants the formulation to stay for longer period of time in the stomach. So gastro-retentive drug delivery is an approach to prolong gastric residence time. Means you want to increase the residence time of the formulation in the stomach. Why? There are two reasons. First is targeting site-specific drug release in the upper GIT for local effect, and second is for systemic effect. What does this mean? Means in some case you want the effect locally, means you want the effect in the stomach. For example, peptic ulcer, effect you want in the stomach. So you want the drug to stay for longer period of time in stomach. It will give better effect. That time you will prefer GRDDS formulation. In other case, when the drug is more soluble, more absorbable in the acidic environment or in the stomach condition, that time also you can prefer GRDDS formulation. For example, while the system flows over the gastric content, drug is released slowly at the desired rate. Means, example, if I am preparing floating drug delivery system, GRDDS, so what will happen? Formulation will float in the GI fluid and it will release the drug slowly and the drug will stay for prolonged period of time. What will happen? Retention time will increase and the fluctuation will decrease. So, gastro-retentive drug delivery system provide efficient means of enhancing the bioavailability. When absorption will increase, definitely it will enhance the bioavailability, and when it will prolong the residence time, we will get sustained release, controlled release effect. That's why this formulation GRDDS systems are very popular. They are getting popular day by day. Why? Because they are very easy to manufacture. They are cost effective systems. And we can use this system especially when we want to target a specific part in the body, GI tract. For example, duodenal part for treatment of cancer, inflammation, and so on. And this GRDDS systems, they are becoming the valuable tool. Mainly for whom? For patients who prefer oral formulation than other routes of administration. And as compared to the conventional oral formulation, this formulation will reduce the frequency of administration. So, these GRDDS systems are getting popular. Before moving forward, we should know the rationale. What is the need? Why we want to increase the residence time and prepare this gastro-retentive formulation? So, there are different reasons. First is, if the drugs that are absorbed from the proximal part of the gastrointestinal tract, there are few drugs which are better absorbed in the acidic condition, which are better absorbed in the upper part of GIT. And if it stays there for the short time and move forward, they will not show complete absorption. So, we want them to stay at the place where they are better absorbed. Next is drugs that are less soluble or that degrade at the alkaline pH. There are few drugs which are not soluble or less soluble in alkaline pH. So as it moves downwards, the condition goes from acidic to alkaline. So drug will be less soluble. Then so we will get low bioavailability. Even some drugs get degraded at the alkaline condition. So these things should not happen. So we want that the drug should reside longer in the upper part only, in the stomach, so that we get better absorption, better viability. Drugs that are absorbed due to variable gastric emptying time. Sometimes the gastric emptying time varies and this affects the absorption of the drug. So for complete absorption, drug should, if the drug stays long, the gastric emptying time will not be affected and absorption will be better. In few cases, local or sustained drug delivery to the stomach and proximal small intestine to treat certain conditions. Just I said many times, like for the acidity condition, peptic ulcer, any stomach infection, or for chronic bowel disease, or for some cancer of the small intestine or so, we want the drug to stay at the targeted site where the diseased organ. When it is stomach or small intestine, that time GRDDS formulations are preferred. And it is also used for treatment of peptic ulcer caused by H. pylori infections. This frequently occurs because of H. pylori peptic ulcer. So that is a situation in which ulcers are seen in the stomach. So if the drugs resides, we will get better efficacy. Students, let us know what are the potential drug candidates for gastro-retentive drug delivery system. Means which are the suitable candidate for preparing this type of formulation. Drugs that have narrow absorption window in GIT, means they are not absorbed in the entire GI tract. At the specific site, they will have absorption mostly at the upper part. For example, L-dopa, para-aminobenzoic acid, furosemide, riboflavin. So these drugs, they are better absorbed in the stomach. So obviously, if they stay longer, they will give better viability. Drugs that are locally active in the stomach, means we want the effect in the stomach. For example, misoprostol, antacids. Third case, drugs that are unstable in the intestine or colonic environment. Means one thing was that they are absorbed better in the stomach, or second case is drugs which are not stable, which degrade or which are not absorbed in intestine or the colon. Means later on they will be not giving the desired effect. They will not get absorbed if they do not reside in the stomach for sufficient time. For example, captopril, ranitidine, then metronidazole. These are some examples. Drugs that disturb normal colonic microbes. There are in the colon there are some microbes which is known as colonic microbes, and there are some antibiotics which are used for eradication of this Helicobacter pylori. For example, tetracycline, clarithromycin, amoxicillin. So they will disturb the microbial flora. So better they should reside in the stomach and not go to the colon. Drugs that exhibit low solubility at high pH. When we move from stomach to small intestine to the larger, the pH goes on increasing, and there are some drugs which are very less soluble at high pH, so they will not give good absorption or bioavailability. So they are suitable to prepare GRDDS formulations. Example, diazepam, chlordiazepoxide, verapamil. Now let us see advantages of GRDDS formulations. There are some obvious advantages. This system offers improved bioavailability. Just I said that when the drug will stay for prolonged period in the stomach, sometimes absorption will be more, so we will get more bioavailability. It reduces dose and dosing frequency because we are getting sustained controlled release effect. So the dosing frequency will also be less. This system minimizes fluctuation of drug concentration in blood because the drug is showing controlled release effect. The fluctuation of the drug in the blood will be minimal. This system helps in targeting of drug. If we want local effect, we can target by this formulation in the stomach. Local action can be achieved in the GIT. Yes, for example, like antacids or for H. pylori infections, we want local effect, we can use this type of formulation. This system reduces the side effect. This will stay for a long period of time. It will show sustained release effect. It will not distribute unnecessarily in the different parts. So we are expecting less side effects. Sustained release can be achieved. Because of prolonged release, sustained release effect is seen. Oral route, this is the safest route of administration. As we all know, it is economical because this is very simple technique to prepare this formulation. No costly excipients are used. So this is economical and it can be used for wide range of drug. So many suitable candidates are there which can be prepared for GRDDS formulations. Along with these advantages, there are few disadvantages also. Like we have to drink plenty of water when we take this formulation. Few drugs are there which are not soluble, not stable in the GIT. So we cannot prepare GRDDS which will even allow the drug to stay longer. Or drugs which undergo first pass metabolism like nifedipine, they are not suitable for GRDDS. Drugs which cause irritation in the gastric mucosa, for example aspirin, NSAIDs, they are not suitable. Drugs that absorb equally well through the GIT. When drugs is absorbing equally all over, so why there is a need to reside in the stomach, like isosorbitol nitrite, nifedipine. So these are the cases where there are limitations of GRDDs. Now the important part of this chapter is GRDDS approaches. How you will prepare, what principles you will use so that your formulation should reside for longer period in the stomach. Simple है, आप दिमाग लगाओ, अगर एक बाउल में पानी है उसमें अगर आपको कोई चीज ज्यादा देर रुखाना है तो आप क्या क्या कर सकते हो. एक तो उस चीज को बहुत हल्का बना दो, पानी से हल्का रहना चाहिए ताकि वो ऊपर फ्लोट हो, या वो चीज इतनी भारी रहना चाहिए कि वो एक जगह पे जाके बैठ जाए, हिले ना. So simple. So it is high density system, means it is having high weight. So its mobility will be less. So it will reside for more. Next system is floating. Floating why? Because low density. If it is having low density, it will float. So because of floating also it will reside more. So these are two basic things: high density, low density. Other approach is bioadhesive, means you stick to the wall of the vessel in any way, then it will not be able to move further. So it will reside longer. Third is raft, means some obstacle, a layer which will not allow the drug to cross that fluid. It will float. So it will reside for longer. Next is magnetic system. We know magnetic attraction is there. So if we are having internal magnet small in the formulation and we apply externally magnet, it will attract and keep the formulation at the particular site. Next is expanding system, means if there is a specific space, that is pylorus sphincter is there, if the size of that formulation will be greater than that tract, the mouth of that tract, then it will not be able to pass. So how we can enhance that size? By swelling that system or unfolding, opening it, so that the size increases, it expands and it will not pass further, means it will reside for longer. So I will again repeat, these systems are very easy to remember. First thing, you make it very light, low density, allow it to float, it will reside for longer. Second thing is you make it heavy so that it will stick to a place, it will not move much, so residence will increase. Third thing is you make it sticky so that it will stick to the wall, it will not move much. Fourth thing is you increase the size by swelling or unfolding, so it will not pass the pylorus sphincter. Next thing is you put the magnetic particles so that it can be attracted by the magnet and it shows attraction at stays at a particular place. Coming to the first approach, that is floating drug delivery system, means we are preparing low density formulation that will float in the GI tract. What is the classification? Three types of systems we can prepare in floating delivery. Effervescent means CO2 gas will release, non-effervescent, and third is raft forming. In the effervescent system, there are two types. Gas generating system, which can be prepared as single layer or multi-layer, and they are prepared as capsules, pills, both. Then another type is volatile liquid, that is vacuum system. There are two types, intragastric osmotically controlled or gastrointestinal inflatable ones. Then there are non-effervescent systems, which includes hydrodynamically balanced system, matrix layer tablet, alginate beads, hollow microspheres or microballoons, ring capsules, flames, magnetic systems. And the last type is raft forming. It means in situ gel formation, means when it comes in contact with GI fluid, it will form raft, means colloidal layer. So we will see one by one in next slide. First system in the floating system is effervescent system, also known as gas generating system. What is the principle? Effervescent reaction takes place between what? Acid and a base. Acid like citric acid, tartaric acid. Base carbonate, bicarbonate. And by this reaction, carbon dioxide is liberated. And this liberated gas is entrapped in the hydrocolloid layer of that polymer. And because of that, what happens? The gravity, specific gravity is reduced, which will allow the formulation to float. So, mainly this system is prepared by the soluble polymers like polysaccharides like chitosan or methocel, and we want effervescent compounds also like sodium bicarbonate, citric acid, tartaric acid, alone. What is the approach? Again, I am repeating. In this system, like we use resin beads, and it is loaded with salt like bicarbonate, carbonate, and it is coated with polymer like ethyl cellulose. And this coating, what it is insoluble, but it is permeable, so it will allow the water to pass. And because of permeation of water, the carbon dioxide gas will be released, and what it will cause? The bead to float. Another method in the floating system is effervescent volatile liquid containing system. Means here we are having a liquid, for example ether or cyclopentane, which will convert into gas when it come in contact with the body temperature. So after this liquid converts into gas, it will inflate the system. It will inflate that chamber like a balloon. It inflates, and because of that inflation, it will allow the system to float. And this device, the plug, is made up of bioerodible polymers like PVA, polyethylene. So they will gradually, slowly dissolve, and then they will release the gas, and the system can collapse and it can be ejected. Next, we will see non-effervescent system. In this system, main composition 20 to 75% weight by weight is hydrocolloids. What are they? They will form gel. They are highly swellable. For example, we can use polymers or polysaccharides. What is the mechanism here is these hydrocolloids, when it come in contact with GI fluid, they will hydrate. On hydration, they will form colloidal gel barrier at the surface of GI fluid, and which will control the permeation of the GI fluid inside the system, and therefore the release will happen slowly. There are two types. First is hydrodynamically balanced system. They are also known as colloidal gel barrier system. Same, just as I said, they are using hydrocolloids like HPMC or carrageen or ethyl cellulose. They can even use matrix polymers like polyacrylates. And this system, when it comes, these hydrocolloids, when it come in contact with gastric fluid, this system will hydrate, and on hydration, they will form colloidal gel barrier, and this barrier will control the permeation of fluid. Next is alginate beads. So to prepare this alginate beads, we can use the aqueous solution of calcium chloride and drop sodium alginate solution into it. Then we will see calcium alginate will precipitate, and these beads can be desiccated, they can be dried, and after drying we will see they are very porous, and because of low density, because of porosity, they will remain floating for around 6 to 12 hours in the stomach. Next system is microballoons or hollow microspheres. In this system, drug is loaded in outer polymer shells and inside it is hollow, and because of low density, system will float. They are prepared by simple method like solvent evaporation, solvent diffusion methods. How we will prepare? Aqueous solution of drug is prepared, and the another phase, organic phase, having polymeric solution is added in the solvent like chloroform, and it is stirred. Then emulsion will be formed. This formed emulsion is then added to large quantity of water which is having emulsifier. It will form multiple emulsion, and this emulsion is constantly stirred. कब तक? Until the organic solvent is evaporated. After the solvent is evaporated, the microspheres will be formed, and these microspheres will be washed and they will be dried. So they can be prepared with different polymers like polycarbonates, calcium alginates, or we can also use plasticizers for better efficiency. And different solvents are used, organic solvents like ethanol, chloroform, and we get promising results. These micro balloons, they remain buoyant, means they remain floating at the surface of the GI fluid for around or more than 12 hours. And this hollow microspheres have been ranked. They are the most promising floating system because they combine the advantage of multiple units. Small multiple units are there and they show good buoyancy. Next one is expandable system. Here the goal is to increase the size. There are two types of systems. One is unfoldable and next is swellable. Both will be in the form of a capsule, and when it comes in the stomach in contact with the GI fluid, first one, it will unfold into different shapes. It may be disc shape, tetrahedron shape, ring shape, different shapes, geometrical forms. But what is important, that the size should increase. It should be larger than the diameter of pyloric sphincter. Then if it is bigger, then it will not be able to cross the pyloric sphincter, and that's why it will retain in the stomach. This is unfoldable system. Next one is swellable, means some polymer is used, agents with mechanical properties which have osmotic absorption of the water, and because of that absorption of water, it will increase many times in the size, more than the size diameter of the pyloric sphincter, and again because of the greater size, it will retain in the stomach. Next one is high density system. As we have discussed earlier, we will increase the weight density. For that, we should know what is the normal density of the GI fluid. So in the stomach, normal density is 1.004 grams per centimeter cube. Means for preparing this type of system, we should have density more than this. So for making, we need some heavy core materials, inert materials, which will increase the density. Some common materials that are used are like iron powders, barium sulfate, zinc oxide, titanium oxide, which will increase the density up to 1.5 to 2.4 grams per centimeter cube. We want approximately the density close to 2.5 grams per centimeter cube if we are expecting significant prolongation. अगर हमें सफिशिएंट टाइम तक चाहिए कि फॉर्मुलेशन स्टमक में रुकना चाहिए, तो उसकी सफिशिएंटली हाई डेंसिटी चाहिए around 2.5 grams per centimeter cube. But here there is one limitation. Problem is there, we want density more than 2.5 grams and also we want sufficient amount of drug. So if we have drug more than 50%, it is technically difficult to prepare this formulation with density more than 2.5 gram per centimeter cube. Next is bioadhesive system. Bio means biological membrane, epithelial surface of the stomach. Here we are talking. And adhesive means adhere, to stick. So in this approach, we will select some polymers which are having this sticky adhesive properties to this epithelial surface of the stomach. And because when it will adhere to the surface of stomach, it will retain there, it will prolong the gastric retention. So this muco-adhesion mechanism, there are different theories which define this mechanisms, how it can take place. So first theory is the wetting theory, which is based on the ability of that muco-adhesive polymers that it spread and forms contact with the mucus layers. Next theory is the diffusion theory. It states that there is interpenetration of this mucin strand in the porous structure of the polymer. Then next theory is absorption theory. It states that there are different forces like van der Waals force, hydrogen bonding between the polymer and the membrane. And the last is electronic theory. Here it states that there is attraction, electrostatic forces between that glycoprotein mucin and the adhesive material, maybe the polymer. Next one is raft forming system. Raft is like a layer or stratum which is created at the top of the GI fluid and which will increase the residence time. This formulation is gaining importance for GI infections, local effects. How is this raft formed? Generally, we are using a gelling agent in this and some carbon dioxide forming agents like carbonates. And when this gelling agent comes in contact with GI fluid, a viscous cohesive layer, thick cohesive layer is formed which floats at the top of the GI fluid. Because why it will float? Because it is having low density. How? Because of formation of carbon dioxide. So two main ingredients used here are gel forming agent and alkaline bicarbonates or carbonates, which will be responsible for formation of carbon dioxide, because of which the system will be less dense and it will float in the GI tube. Next system is the magnetic system. Here approach is magnetic attraction. When we are preparing formulation, we will have API excipient. Along with that, we will use small internal magnets. And then we will apply external magnet and place it over the abdomen and hold it in the position where we want to position that dosage form. And because of that magnetic attraction, it will improve the gastric residence time. But problem here is that exact position to hold that magnet with that accuracy, that will create patient incompliance. We have seen so many approaches to prepare gastro-retentive formulation. Let us see what are the several applications of this formulation. First one is bioavailability enhancement. Definitely, if the drug will reside more in the stomach, it will give good effect, more absorption. Even for drugs which are more soluble at acidic condition, more stable, they will show better bioavailability. Next is site-specific drug delivery. If you want to deliver drug at specific site like stomach for some condition like acidity, then we will have site-specific drug delivery. Sustained drug delivery. Yes, prolonging the stay in the stomach will give us sustained effect also. Enhancement of absorption. For drugs which are better absorbed at acidic condition, they will show enhancement of the absorption. Minimize adverse activity at the colon. Many drugs, they are not suitable to be delivered at the colon. The microbial flora degrade them. So that activities can be minimized. Here are the references which I have used to prepare this presentation. Thank you for your patient listening. If anyone have any doubt or questions regarding this presentation, please do write in the comment box.